Hi, everyone. Welcome, and thanks for joining today's webinar on HealthInfoNet's specialty care use cases. My name is Chad McLeod. I'm the Director of Product and Communication at HealthInfoNet. Just as a note, today's session is being recorded, and it will be provided back to you in a video after today's training. So just a quick background and intro before I pass things over to Sharon. So beginning last fall, HealthInfoNet kicked off new educational campaigns in which our clinical education team researches and develops online training courses, marketing materials, and user testimonials, and webinars like today's as a way of focusing on particular types of organizations and how the statewide health information exchange can assist them in their clinical workflows. Last quarter, our focus was on long-term care participants, and this quarter is, of course, on specialty care participants. Over the last month, Sharon and our clinical education team have reached out to all of our specialty care end users. That's over 350 individuals with these materials and information that we'll share today. So without further ado, the presenter for today's webinar is Sharon Bearer, HealthInfoNet's Clinical Education Coordinator. Sharon will be joined by June Sapiel, Health Information Associate at Northern Light Cardiology. Throughout the course of today's meeting, if you have any questions, please feel free to add them to the comments to the chat, and Nicole, who is our clinical education manager, and I will provide answers as we go. And just to prevent background noise, we do ask that you keep your audio muted. So to officially kick off today's webinar, I will pass the baton over to Sharon. Sharon?
All right. Hi. Thanks, Chad. Hello, everybody. Again, I'm Sharon Bearer, and one of the clinical educators. Now, I know when I looked at the list of people who are joining today, I actually know some of you and have actually trained you. So looking forward to working with you again and going through this PowerPoint on specialty care and to help you to understand how our services can assist you, particularly in specialty care clinical workflows. So let's get started as soon as. So this is a slide just with some information how to reach out to me and out to HealthInfoNet Clinical Education. Now, like I said, some of you have already been trained. Maybe some of you are looking at this for the very first time. But one of the reasons we're doing this is we want to be able to present to you what we can do to help you with patient care, patient coordination, the collaboration of working with other providers, your primary care doctors that are referring patients to the specialty offices. And this is one of the ways to reach out to us. And I'll go into that a little bit more at the end of this presentation, different ways that you can be trained and learn a little bit more about what we can do to support you. So let's just quickly go through the webinar objectives so that you all know what I would really like you to learn and to be able to leave the webinar with extra knowledge is to identify and review the specialty care use cases. How would we use HealthInfoNet with interventions with our patients? Understand how to use this data and the tools that are available to you within the exchange to support quality and continuity of care. We say those things all the time, and we're always looking for better ways to take care of our patients. And we're focusing today on the specialty care patients. And also to learn how the specialty care teams, they're using the actual tool in real life people into how they're improving care management activities. So we're looking forward to showing that to you. So let's just start with top use cases in interventions. And this is just the first overview, and I'll go through each one separately. But one of the things is to evaluate referrals and treatment plans, to conduct medication reconciliation, increase coordinated care efforts, improve post-procedure planning, and also a lot of people are using HealthInfoNet for supporting your performance measurements. Now we know we all do this information, but how can we do it better? Well, let's start with the evaluation process. HealthInfoNet, because of the data that we have on the patients are being referred to you, you now would have access for care summaries received from the primary care providers. So this is going to help you for prior authorization requests. Sometimes I remember working in certain offices where couldn't schedule the patient until that authorization request came in, and it lagged for gaps of information. So this is going to help with that. To review previous primary care office notes, to have that information available for that visit. These would include your active problems that the patient has with chronic conditions, like lab results, radiology reports, very important for your orthopedic patients, hospital and procedure notes if they happen to be in a hospital. And lastly, and I find this as a nurse myself, I find this part very important. Isn't it nice to send a patient from a primary care office to one of your offices and ensuring that the patient is going to have confidence and satisfaction knowing that this collaboration happened between their primary care and your office? Because the data's there, you know who the patient is, you know what their problems are, and you have that information. I think that's just so important. This is just a snapshot, a screenshot of what the clinical portal looks like. And again, I know some of you have seen this, but if you haven't, this is the clinical portal with the data that you'll be looking at to find the information that you need. Now, it's used for clinicians, obviously, to look up data, help desk in your facility, and that would help you to get a new user account if need be, if you've decided that you want to be a user, and also for auditing, which we do regularly. We also have HINcontext application. Now, HealthInfoNet now has this particular application that embeds the actual exchange data directly within the provider's ERs, their electronic records. Now, and they used to have to leave it and get into HealthInfoNet. Now it's going to be actually in the system. It was introduced to Maine Health Epic, so some of you Maine Health people on the call, you might have seen it. And it's currently being implemented in Coordinated Epic. So all good news as we continue to improve how we get this data to you quickly, easily, and readily. The next thing, now I know that this is a problem for a lot of specialty care, making sure that you have conducted med reconciliation and making sure that the patient has given you a complete and thorough medication list. Now, how many times have we heard, well, I take one pink pill in the morning and one blue pill at night, and you say, okay, that's not going to help me. So this is going to confirm correct medication list for you where we have that data. It's going to prevent duplications of medications. You know, they may already be on an antibiotic, but when they see you, they need to be put on one. Do you know what the name of the medication is that they're already on? To prevent misuse and risk of harm, one of our biggest things as healthcare providers is to decrease harm to our patients and risk to our patients, which would include also adverse drug combinations and interactions, and maybe even the dosing levels that they're on. The information also would be what type of data source is going to be available for you to look at. So demographic information, obviously very important. We have encounter histories, diagnoses and problems, allergies with adverse effects, vital signs, immunizations, getting more important every day. Our medication history, as I spoke about, radiology reports. We also have documentation of social determinants of health. We're adding more to that as time goes on. Very helpful for whole person care. And of course, laboratory and microbiology results. So if you look at this slide, you're saying, oh my goodness, this is a lot of information I need. about my patients before we see them and when they're here for their consult. And to coordinate care. So how we do this, obviously, is through communication with the primary care provider. They're entrusting you to take care of their patients, and you want to make sure that you've got the shared information to develop care plans, maybe, or to communicate what's going on with the patient. It can be very confusing to patients today. They might even see 2 or 3 specialists alongside their primary care. It's very daunting, and I actually feel quite sorry for some of the older population who have to deal with all of this, and we can help them as healthcare providers by having the information. Another thing, and I'll talk a little more about this in one of the next slides, is our notification alerts, and this helps with coordination of care, where we have a tool that's embedded in the system that can allow you to get a real-time notification on your panel of patients if they happen to be going into the emergency room in real time or be admitted. It just helps you to be able to do that, transitions of care, or to prevent a readmission, perhaps. And as I spoke about, this is the notification services. And when I train, I find out if that particular office or organization that I'm working with is interested in knowing a little bit more about the notification services. This is an amazing tool. When I first learned about using this, I couldn't believe we actually had something that could help so many people. I remember when I was working as a nurse, this would have been great for me to know about patients. So again, this is embedded in the system. It's easy to use once you know how, and once you're trained and have a user manual to walk you through it. It literally is real-time alerting of time-sensitive events. And this gives you a list of some of the events that are available, like admitting to the hospital, maybe even being discharged from the hospital. What a great time to do transitions of care when you get the person just leaving the hospital. So this takes a little extra training within the clinical portal training process that we have, but we'll certainly love to show you that. And if you have any questions about that and want to know more, please give me an email or a call, and we'll talk about it. And as always, post-procedural planning. We can talk to patients over and over again about what needs to be done post-procedural. Do this, don't do that, see us then. It is so hard. So we want to ensure that safe and seamless transitions of care following surgery or procedure. So we're able to work with the data to show you comprehensive discharge care plans. And this is reviewing their medications, follow-up services, office visits. Perhaps they need equipment needs to get home. This helps you to identify that with the patient, and also recommending home care services. We're using home care services so much more these days, and it's nice to have them to be able to see our data and for you to see theirs as well. And again, that seamless transitions of care, which we all understand and really need that, need to know the patient's specific health needs and risks. And again, for all care coordination is just so important. And there I go with that improved communication again. I guess HealthInfoNet is probably one of the best communication tools that we have available between different offices. Excuse me. So a lot of people say, well, who's connected? Well, we are connected to all the health systems, hospitals, acute care, critical access hospitals. There's 34 of them, or 35. I think there's 34 or 35. Where different reference labs, behavioral health, and post-acute care facilities. So very important to know if your patient has gone to a SNF unit after surgery. We have ambulatory facilities and FQHCs, which are our federally qualified healthcare centers. SureScripts, where we get our medication data for you, as well as Maine Care and Medicaid pharmacy data sets. And also, fairly new is our Maine Emergency Medical Services that helps you to be able to see your patient information, perhaps if they had an ambulance run. I get this question a lot. Well, Sharon, who should have this in our office? You know, who uses this throughout the state? It has grown. I've been with HealthInfoNet over 8 years now, and it has grown when I started. And this just gives you a little list of some of the people that are using it. Obviously, registered nurses. MAs are the highest utilizers. For all you MAs out there on the call, kudos to you for being some of our highest utilizers in the state. But medical records, PSRs, the ones who are collecting the information as the patient comes through the door, care managers, the emergency room. Long-term care, we just did a specialty program on them and learned a lot about how they're able to use our systems. Physicians, behavioral health, pharmacists, epidemiologists, infection control, quality analysis. So you can see there's a big gamut of the healthcare team that needs to use this information. Also working in a hospital setting, I really understand a lot about performance measurements and having to pull data together for whether it's for CMS or your facility or the state. It can be quite daunting, and it's really nice to have this information. A lot of people are using this tool to provide the data to support their evaluations of their performances. So one of the things is that it does support the performance reporting initiatives by just having the information in the data repository to fill in data gaps in longitudinal information. You know, how many colonoscopies, when was their last colonoscopy? When was the last time they went into the hospital, or did they have a repeat ED visit? Very important for us to be able to pull that data in there for you. And we produce a variety of quality, utilization, and predictive risk management measures. This is to help providers identify potential weaknesses in the system, prioritize their opportunities, identify improvement areas. I think we have some quality people on the call today, so I'm sure your eyes are, oh, that looks good. How can I use that? Health outcomes and equity based on both clinical and community activities, determinants of health. That's one of the reasons we're collecting that particular data, and very helpful in whole person care. And some of you may recognize a lot of these quality measurements that we also support is the HRRP, which is Hospital Readmission Reduction Program. How many people do we, on the call that say, we don't want that patient to go in 30 days after, within 30 days of the surgery, knee replacement, cardiac surgery, whatever it might be. And all the CMS core measurements, as I had mentioned, and also the National Quality Forum reporting. So that is just a few. I'm sure there are a lot more, but I just wanted to let you know this will help you with that as well. One of our other platforms that are available to some organizations that provide this service is Analytic and Reporting Platform. It is leveraging real-time clinical data across the care continuum. And this helps clinicians to, again, drive the quality improvements to manage risk and population health. So we have organizational performance, which is the KPIs, and a lot of people are familiar with that, population risk, and that 30-day readmission risk. Again, want a little more information about this, please reach out to us, and we'll help you get more information on that. So just to recap, we talked about evaluating referrals and treatment plans, conducting med recon, increasing coordinated care efforts, improving that post-procedural planning where a patient cannot follow through and need to be seen again, and also supporting that performance measurements. So what I'm going to do now, and again, like I said, some of you have actually been in the clinical portal, so this may be a repeat for you. I'm not going to be doing a training, but what I want to do is just show you, for those who have not seen the clinical portal, a little bit about it and what it looks like. So here we are in the clinical portal, and I'm going to go to recent patients, and we have this menu over here that has a lot of little tricks, and I can show you that during training, but I'm going to go to recent patients because I've been in this record before, and I'm going to click on my test patient to show you some of the stuff that's really good for you to be able to see. It's one page, and I'm going to scroll down here, and there's 5 things I want you just to be aware of that's available for you. This is what the demographic aspect looks like. Over here, all the different allergies. Here's a list of all the patient's active problems. And it also shows the location that actually sent the information. We aggregate the data, so if you're looking down on this patient's diagnosis and they're coming in for a visit and you notice they have hepatitis, for instance, you can look here and hover, and it'll tell you who sent the data, so that you can start right away researching information. What type of hepatitis? Where was the last titer? It just is very helpful for that information, for that type of data. The next are our medication list here, readily available for you to look. I only have 3 meds here in my test environment. And then these are all the encounters that the patient has been. So you can look through this and see all the emergency visits that the patient has had. You can actually even do some sorting with this data for quality metric reporting. It might be good to say, you know, we could see this patient went to the emergency room many times. Let's see how we can prevent that from happening. Again, all of this data is very important. And because of the asterisk here I told you about, if they have an asterisk, you can hover and you can see what the procedure code might be for that particular visit. So just quickly looking at this one page and hovering a little bit here and there as needed, you really know a lot about the patient already. It's you know, critically evaluating and critically thinking about this data. You can say, I know a lot about this patient on one page. That didn't happen before the exchange. It makes it really great. And I'm going to make my screen just a little bit smaller so I can fit it. There we go. I'm going to move this line here to just show you this is where all of our documents are located. This data is in the documents to support a lot of the data here. So if you want to know a little bit more about this particular visit, emergency room visit, you're going to go over here to the data, and these are folders that you're going to open up and look at the discharge and history summary. They might be discharged from the hospital and you want to know how that visit went in the hospital. By clicking on that, it's going to show now in this screen the actual history and discharge. And you're able to print this information off. So I know how important this information is. You might go all the way down and say, okay, let's see, what was the discharge plan? When is the follow-up appointment? What is the preparation? Which providers saw him? All that information readily available for you. We have emergency room visits, immunizations, laboratory. A lot of times for cardiac patients, I know you're looking for the INRs. You're looking for information. This is right there, readily available for you from all the places the patient had blood work. There's a lot of fancy stuff you can do with blood work. I'm going to just click quickly on one of the tests so you can see what it looks like. And it looks like a regular CBC without a diff. There it is. There's your results and your reference range, and you can print this off as well. So that's laboratory. We have microbiology, operative reports. We have radiology. Now for the orthopods in the office, on the call, we don't obviously have the packs, but we do have an actual reading from the radiologist. So that information is readily available again for you. We have other information. This is the community service tab up here. This is your My Patient tab for your panel of patients. And again, the training would show you how to add and delete patients as needed easily from clicking on that tab. And this little box here has some great sorting features where you can literally change the look of this data quicker than anything. So like, for instance, and I'm just going to show you because it's so quite amazing. Instead of having to look through all of this data and you want something very specific, you're going to click this little search button and you're going to say, you know, did the patient have a colonoscopy? You're going to start spelling the word colonoscopy and there that information is. The others do amazing things too, but that just is one that I wanted to show you. And then of course we have our refresh button. Here on the menu, which is toggles over, it's always over here on the left, is our notification tool. I told you that it was embedded in the system, and there it is. With a little training, you can certainly know how to use that. So that's the little demonstration of what is in the clinical portal that may help you as you look for data and need data. And again, I know some of you know about this, but the ones who don't, I'm hoping that you say, boy, we need to know a little bit more about that. And then we hear from you. All right, I am going to switch over. Let's all keep our fingers crossed that I stay on the Zoom and you can see me. Are you able, Nicole, to see my PowerPoint now?
I am.
Oh, how nice. Thank you. So that's the clinical portal demonstration. And let's move on. This piece I'm very excited about because this shares what the HealthInfoNet value proposition is. So this is, what is our value to you? You know, you've got a lot of things to do. Why going into this system as another system going to be helpful to me? Well, we put together this slide, and actually this is one of my favorite slides because it really just visually shows that you're trying to get to the target, the middle of the target, to focus on patient care. But specialty care, and I know a lot of the type of work that you do, there's a lot of challenges. So to make your job better, easier, more rewarding, and most importantly, for better patient care is to face some of these challenges by using HealthInfoNet. So let's start with the challenges. Evaluating new patient referrals coming in, you don't know anything about the patient. This requires piecing together complex medical histories from multiple sources. Very, very hard. I mean, if a patient, you get referred by a primary care doctor, well, they might see a cardiologist too. You can't have surgery until they're cleared by the cardiologist. So now you got to look for more data. Updating a patient's care plan following their discharge. You can lose them. Where did they go? Which pharmacy did they go to now? Which physician are they seeing? This will help you with that. Coordinating a patient's care during transitions with medications, particularly to look for any adverse effects, and also accurately and reliably evaluating performance against benchmarks. And when the systems, you need to collect so much information and it's fragmented and incomplete. So let's go to where the target is hit. There you go. That's why I like this slide. It's very visual, and I think it really hits home how HealthInfoNet can help, because it does improve communication and care planning. It does assure comprehensive and accurate information available at the point of care from all the different providers. It improves both quality and cost outcomes to prevent those readmissions. And it just assists in targeting care for patients with chronic diseases, risk for future utilization, and quality measure gaps. So this is what it does easily and readily for you. when I'm going around the state, well, actually before COVID, I used to actually go into different offices and the hospitals and do one-on-one trainings, and I absolutely loved it. I got to meet so many of the users throughout the state and really got to understand how they use it, why they use it, what do they like about it, what don't they like about it, how would they like to see it improved. And we always like that information. I've gotten lots of information from users that needed particular information, and I brought it back to the team, and they were able to eventually get it into the system. And they also share with me some of the ways that they use the clinical portal. So whenever I get a really good testimonial, I say, can I use that? And I write it down, or I reach out to people and say, can you tell me how you use it? Well, I have a few to share with you. I'd like to start with this one with Jessica Kilton, who's a certified medical assistant, and she works at St. Mary's Center for Orthopedics. And she says, quote, "We use HealthInfoNet to obtain the necessary data, medications, allergies, ED and outpatient notes, and radiology reports to help our patients determine the right, to help our providers determine the right plan of care for our patients." Pretty much in a nutshell, how wonderful it works. Our second testimonial comes from Nancy Austin Stacy, who again is another CUCMAs, you're amazing. She works at St. Joseph's Gastroenterology. And I like what she says. She says, quote, "Our entire team uses HealthInfoNet on a daily basis. Their services help us address scheduling challenges, facilitate referral evaluations, and prepare for upcoming consultations and procedures." I love hearing that. It always makes me happy, but I'm also very happy for the next slide. We actually have the person who gave us this testimonial on the line with us as a guest. June Sapio works at Northern Light Cardiology. I've been working with her and talking with her, and she was kind enough to join us today. So June, I'm so happy to have you on board, and I'd like you to actually read your testimonial. And then if you don't mind just sharing whatever information you might like to share with your colleagues from other specialty offices throughout Maine. Again, June, thank you for joining us.
Good morning, Sharon. Thank you for having me. My name is June Sapio, and I work with Northern Light Cardiology as a health information associate. My role with Northern Light Cardiology is to get medical records for our providers for our patient cares. So my quote today is, "We often have patients that book appointments with us within 24 hours. Having HealthInfoNet helps us obtain real-time information about those patients so that our providers can be prepared and well-versed in advance of their visits." So HealthInfoNet has helped in these cases of needing the information in a speedy way for our providers so that the patients can be seen, rather quickly. A lot of our patients are patients that have been recently discharged from the hospital and need to be seen fairly soon with our providers. So HealthInfoNet provides all that information. And so my role is to gather it all together, get it ready for our provider, and make sure that they have everything that they need, and not having to go to 10 different places to get this information has been so very helpful. It's an immense time saver, and 8 times out of 10, HealthInfoNet has basically everything I need. And there are a few, records that maybe that aren't input into HealthInfoNet, but mostly it's almost always in there. So on a day-to-day basis, we're dealing with 30 to 50 patients per health information associate. So we have to, retrieve those records on a day-to-day basis. And having HealthInfoNet makes it, much easier for us to gather that information together without having to fax, without having to call, without having to mail all this information. It's already there in HealthInfoNet. And so, you know, I truly believe that having that information helps to drive the cost of healthcare down, because we're not spending so much time looking for all this information and, you know, trying to gather it and get it together. And it helps, you know, save time and save money. So yeah, so on a day-to-day basis, 30 to 50 patients, and we're pulling those records, and, you know, 8 times out of 10, we're not needing to go anywhere but HealthInfoNet. So it's, you know, it's a great tool to have. I'm very thankful for it. And I did even learn a few tips, Sharon, so I'm thankful for that. And yeah, so if anybody has any questions, you know, feel free to reach out to me. I don't have any problems answering anything. And I can't say enough how thankful I am for HIN.
Well, June, I don't think I could have said it any better. It's almost like that was absolutely perfect. Thank you so much for your enthusiasm and energy. And you said a couple things that I really don't bring up. And see, again, I learned from you as well. You had mentioned the acuity of your patients, meaning they're in the hospital, and before they're discharged, they need an appointment perhaps because they have this acute issue. It's not like they can wait a month to be seen. So you need this information quickly. So that was a good point, and that helps, I'm sure, a lot of people to understand. And also the cost. And we're, you know, all looking for that for all of our organizations. So again, June, thank you so much. So if anybody has any questions for June, you can send it to the chat, and perhaps, and Nicole is checking the chat if there's anything that maybe June can help answer. Excellent job, June. Again, thank you very, very much.
Thank you.
So moving on, some people say, and I just want to just quickly go through the coordinated specialty care to kind of give you an example. All right, let's talk about how would this happen. Well, it would happen when you get the initial consult. The patient's admitted to the hospital. The hospital sends the information to HealthInfoNet. So with that initial consult, there you have that information that you need. Then you go to the care plan. Well, with that information, you have the preliminary hospital information, which may include the ED report, all those labs you need, medications and referral notes. Then you go to either the treatment process or surgery, and then you want to look and see what happened in the hospital setting, and then the follow-up care. As I said before, that's just the line of continuity of care. So as we finish up today, again, as I said, some of you may not be using HealthInfoNet in your organization. You have access, or perhaps you did have access at one point. Maybe there wasn't training available for you at the time. Well, one of the reasons we're doing this as well is to reach out to you to say, yes, training and education is available to you, and there are different formats. So let's just quickly talk about that. First of all, there's the personal support, my favorite, because I absolutely love doing training, and I can do a Zoom training such as I'm doing right now. And then hopefully when we put this COVID pandemic on the shelf, I'll be able to actually come to offices. I've done that to a lot of offices during lunch and learns. So that's the clinical education team between myself and Nicole Yo-Fisher. We can do that. And you can reach out to us at clienteducation@healthinfonet.org. But note that doesn't work for everybody. So we have online courses. We have the HIN Academy, which we offer CNE, our CNE credit. We have the use cases and tutorials on our website. We have these webinar series such as this, which are taped and ready for you to be able to maybe share at an office meeting that you might have. Training resources, tons of them on our website, as well as our communication package, which helps you sometimes to explain what the exchange is to patients who may have some concerns or doesn't really know what's happening and going on with all this information. So it's all good information there for you. So to end, again, thank you very much. I'd like to introduce you again to Nicole Yo-Fisher, who is my colleague, and we are available for you. And this is our information and contact information for any information, questions, or notes that you may have. So let's see, the last page just goes a little bit more with our website information, our customer care information, and what have you. Also, you can follow us on Twitter. I really enjoyed doing this with you all today. I do appreciate your patience during the little technical glitch. I see we do have some questions, and I think I would pass this on to Nicole. If this is a good time, Nicole, to go through that.
Sure. We just had one question around access and if referral staff are able to have access to HIN. They are. That user would just need to go through their organization's process to request account for us through HIN or to HIN. So whoever is they are working with just needs to give that permission to do so, and then we would be able to create the account.
All right. Well, gee, thanks
Great
a lot.
question.
And thanks. Is that all? Is that all the questions that we had?
For right now, certainly we can hang out for a few more minutes too. If folks do need to jump off, that's okay. We understand making the most of the lunch hour here, but we are more than happy to hang out for a few moments if people have questions.
Oh, that's right. I'm giving you all 15 minutes back in this webinar, even with a glitch. So again, I appreciate you all taking time and having lunch with us perhaps. And I'm looking forward to getting some emails. So give me a little shout on email. I'd love to chat with you. And again, thank you all for joining us.